Hi, I'm Marty Salt, and you're watching WFTV.com's Care Connect. Pelvic floor disorders affect millions of women, often after childbirth, with age, or due to other medical conditions. Here to shed light on this important topic is Dr. David Austin, a specialist in female pelvic health and reconstructive surgery at Oviedo Medical Center, part of HCA Florida Healthcare. And welcome. Thanks so much for being with us.
Thank you, Marty.
So, Dr. Austin, tell us more about your specialty, urogynecology, which has only been a specialty for the last 10+ years.
So yes, urogynecology is a multi-specialty field that involves urology and gynecology and also conditions of the bowels. And so they needed specialists that had experience with multiple conditions. And so the field became available recently after special training to specialize in these multiple conditions that involve the bladder, the bowels, and the female reproductive system.
It's really interesting that they weren't always connected, a specialty from the beginning, because all of those problems have always been connected.
Yeah, I mean, these conditions have been around for a long time, but it's only been recently that we have someone that specializes in all the structures that are involved with these conditions.
And can you tell us what exactly are pelvic floor disorders?
So pelvic floor disorders are multiple conditions that are caused by, like you said, childbirth, but also the aging process, chronic constipation, heavy lifting, obesity, and that includes urinary incontinence, loss of bowel control, and pelvic organ prolapses, which there's a relaxation or weakening of the structures that support the organs of the reproductive organs, and leads to the dropping or displacement of those organs.
And what are some of the newer treatments for pelvic floor disorders?
So at HCA Florida Healthcare, we use minimally invasive procedures that are new, including vaginal approaches, which involves no incisions on the abdomen, and also robotic procedures, depending on the conditions that we're dealing with, in which we are able to do what we want to do with small incisions.
And how common are pelvic floor disorders?
Pelvic floor disorders are very common, but women in the past have been suffering silently, but ultimately 20% will end up seeing some type of care for these conditions. But at HCA Florida Healthcare, we use minimally invasive procedures to allow for treatment for these women to ultimately help improve their quality of life.
And that's the bottom line.
Yes.
Thanks so much, Doctor. And if you'd like to learn more about innovative women's health care in your area, please visit HCAFloridaHealthcare.com. I'm Marty Salt, and thanks for watching.